Mostly asked nursing questions. Those questions which are mostly asked by interviewer in hospitals, all are given in this video. There are 3 major factors that should be followed by you to make a good impact on the interviewer. Number 1 is confidence, number 2 politeness, and number 3 behavior. The external judges the students by these factors. Answer very shortly, concisely. Use those words which give complete meaning. Speak less but worthy. Don't show you have more knowledge or be overconfident. This will stuck you in many mistakes. This channel is made for you to help in your clinical, hospital, and college theories. I will try to upload as much knowledge as I can, and I need your help to grow. Please subscribe this channel and press the bell icon for immediately getting notifications of my such type of videos. Most of the repeated questions are mentioned. Thoroughly read and note down these topics to pass the interview. I am 100% sure if you will focus on these questions you will pass the interview. Number 1 is what is the value of vitals or what is vital sign? I have written for adults but you must read peds and elders also. Saturation 95 to 100%. Blood pressure 120 by 80 mm mercury. Heart rate 60 to 100 bpm. Respiration 12 to 20 breath per minute. Temperature, remember the exact value above from the 37 Celsius, it means patient is getting febrile, means fever. I will make a complete video on vital sign if this video get 1000 views. The mostly asked question is what is CPR? Cardiopulmonary resuscitation is the process of life saving, used when someone's heartbeat has stopped, in which we push the chest to make pressure, in order to circulate the blood flow towards vital organs. How to deal with RTA patient. RTA means road traffic accidental patient. As a nurse requires quick, calm, and systematic action to save life, prevent further injury, and ensure proper care. We use proper procedures of A, B, C, D, and E means airway, breathing, circulation, disability, and exposure or environmental conditions. Clean the wounds, and prevent proper form infection. Make sure patient's vital are stable. Otherwise maintain oxygen supply. Check the GCS of the patient. Ensure that patient is conscious or unconscious. After the accident, is there any disability appeared? Interviewer always asks about IV cannula, about its parts, sizes, differences between bigger gauge number and smaller, and fluid flow for each size. I have mentioned the chart, you can read it. One more thing. Interviewer asks if there is no visible vein in arm and legs. Where would you pass IV line? Your answer is in intrajugular vein. Emergency drugs. A vital question for emergency condition in the hospital. Mostly heart attack condition is considered as emergency. The medicines are atropine, morphine, epinephrine, furosemide, dobutamine, heparin, hydrocortisone, midazolam, and dextrose. There are many more emergency drugs. You should know about just 5 to 6. It's enough for interview. IV fluids. There are 3 types of IV fluids are there. Hypertonic, isotonic, hypertonic. Hypertonic means more salt level than your blood, used for brain swelling, and low sodium levels. Isotonic means same salty level as our blood, used for dehydration, and low blood pressure. Hypertonic means less salt than our blood, used for diabetes. Most repeated actions is hand hygiene, and necessary to prevent infection. Every hospital commands on hand hygiene. There are 6 components of it. Hand hygiene is the most cheapest method to prevent infection. Learn about hygiene process. Laboratory questions. Learn about the values of blood and electrolytes. They can also ask about white blood cells, plasma, and platelets. HB level in male is 13 to 17 mg per deciliter, and in female is 12 to 15 mg per deciliter. Electrolytes are: sodium is M135 to 145 mmol/L. Potassium is 0.3.5 to 5.0 mmol/L. Calcium is 8.5 to 10.5 milligrams per deciliter. How to deal with emergency condition. In emergency condition you must plan quickly and start implementation. Do emergency assessment. Monitor vital signs. Identify disease or any acute problem. Use A, B, C, D, E method which I have already told you. Mostly interviewer asks instruments name and sizes. To observe your experience, you must read about the sizes of nasogastric tube, oral gastric tube, and endotracheal tube. Also read about the procedure and tray making. Bed sore is the one of high-risk condition. For old age and dependent patient, must learn about the stages of bed sore. I can't explain in this video, because it will get so long. I will try to make a video on this topic. Learn about its causes, prevention, and treatment. Intubation is a medical procedure, in which a tube is inserted into a person's trachea, to help them breathe. It is commonly done in emergency situations, during surgery, or in critical care. Nursing process. Every nurse follow this pathway, to provide quality of healthcare. Nursing process includes 5 processes to be completed. Number 1 is assessment, 2nd diagnose, 3rd planning, short-term goal or long-term goal, 4th implementation, and last evaluation. I wish you will get success in interview after covering these topics. I will make more videos on this content. Be connected with me, like, share, and subscribe.